Imaging during lithotripsy is an important issue. If you see the stone or stones well, then you will have the chance to treat them in a successful manner. Of course, we need a good imaging, but we may have some difficulties. Difficulties may be related to the patient himself or herself or to the stones characteristics. For example, obese patients, we may have problems with these patients while imaging the stones due to the obesity problem. And also, bowel problems could be present in patients, and bowel gas may overlap on the stones, and we may have difficulty to see the stones during imaging, during lithotripsy. Another issue is the size of the stone. It may be small, and smaller stones could not be imaged very well. And finally, maybe I may say stones near to the bony structures, to the iliac crest or to the vertebral structures, may be difficult for us to image them in a good manner, in a well manner for a successful disintegration. Depending on these problems in the past, we tried to have some small tricks in order to avoid the difficulties that we have in terms of imaging to get a good image, good quality of vision. What we did, we tried to get rid of the bowel gas by moving the patient, changing his or her position. Also, we tended to increase the level of radiation in order to have a good image quality, but it will bring high radiation exposure, danger for us, for the patients. But these are classical tricks we applied in order to overcome these difficulties during imaging. Optivision means optimal vision. With the observation system, now we have the chance to see the stones and other structures very well, because it is an enhanced quality of imaging for us during lithotripsy, and it's a good, great chance to see all small stones, to get rid of all these gas problems, and also to get the image of the stones, to identify them and to disintegrate them in a successful manner. It increased the image quality. To see the stone in a good quality, image quality, that means during the lithotripsy procedure, we will be able to see the changes in the stone structure very well. And that enabled us to see smaller stones with a good image quality, to localize them in a practical manner, not to lose time, to finish the procedure in a shorter time period.